Our guests, or did I start too? Good morning, this is Jim Langfelder, Mayor of the City of Springfield, Illinois. I'd like to welcome you to our Facebook Live. It's 11:30 and we're starting a little bit earlier just to accommodate schedules, but we're really excited about today's panelists to cover vaccinations especially, but also testing and where we stand with COVID-19. But before we introduce the panelists for today, a couple of reminders. If you want to ask questions, you can do so through our chat, or if you want to go to send an email, you can do that at feedback@springfield.il.us. And as questions come in, we'll intertwine them into the discussion as much as possible during this next hour. But with regards to what we're doing locally, we really appreciate the positive steps of everybody cooperating with washing your hands, watching your distance, and of course, wearing your mask, especially in Springfield. I know the Springfield PD really appreciate it because they don't like to write tickets. It's more of a, to protect ourselves and others, the ones we love, so we can keep our businesses open, keep our schools open. Right now, we do have high school sports starting and grade school, so we're really appreciative of that. And then we really just need to be cognizant of where we're going, even though we have the vaccines rolling out. That's very helpful. But with that, you still have to wear your mask when in public. And in the case of Springfield, it's wherever you're going. When you're coming in close contact with others, we want you to wear your mask in the proper way, of course, is over your nose and your mouth, and making sure you protect others that you're around. So the other items associated with the pandemic is vaccinations are underway. The one thing I will share with that, just from my own personal knowledge, is it's a supply and demand. I think we need to make sure we stay patient, remain respectful, and I know the local professionals, they will share what they're up against, but there's a high demand for vaccinations right now, but the supply is few, and so they are ramping up the production of different vaccines right now. But again, if you'd use patience and, for myself, I go through my own healthcare provider and ask them to provide assistance. But if you don't have a healthcare provider, that's when you probably turn to the Sangamon County Department of Public Health or whatever the case may be with regards to that. But today I'm joined by Julie Bickers. She's with Walgreens. She's a healthcare supervisor. As also Dr. Vidya Sundareshan. She's the Infectious Disease Specialist with SIU School of Medicine. And then last but not least is Gail O'Neill. She's the Director of Sangamon County Department of Public Health. And what I'd ask each of them to do, if you take time to introduce yourself, we'd appreciate it, and how long you've been where you're at, and then anything else you'd like to share. And then we'll just open it up to some of the questions that we've already received and moving in that direction. But I'll start with Julie Bickers. She's with Walgreens Healthcare Supervisor, and actually Walgreens is who we use for our pharmaceutical services. It's convenient, but Julie, welcome. And if you'd like to do a self-introduction, we'd appreciate it.
Sure, thank you for having me. So my name is Julie Bickers. I'm a healthcare supervisor for Walgreens. I've been with Walgreens for over 30 years. We'll just say over 30 years. I'm a pharmacist by trade, and I sort of oversee the pharmacies and the clinical aspects of the pharmacies for much of downstate Illinois. So I'm happy to be here today and hope to talk to you guys a little bit about what we're doing with vaccine and testing today. Thank you.
Great, thank you. And next I'll introduce Dr. Sundareshan. She's with the SIU School of Medicine, and we're blessed to have SIU in Springfield. I'm dating myself, but way back when I had my children were younger, the oldest one's 28 now, but we used SIU for the pediatrics, and we're just grateful that they're here. They do many different items, but in today's discussion is focusing on the infectious disease. So Dr. Sundareshan, we really appreciate you participating.
Thank you, Mayor, for having me, and honored to be part of this conversation and to be part of SIU and representing SIU in this conversation today. I have been with SIU. I did my training and residency at SIU, and I've been here for 15 years now, 12 of which I've been a faculty with infectious diseases. That's a division in the Department of Internal Medicine. It's a subspecialty, and we take care of all kinds of infections. Now, of course, COVID being the primary one where, we get a lot of patients that we see with COVID, but all kinds of infections are taken care of by the Division of Infectious Diseases.
Well, thank you very much. And then Gail O'Neill, she's the director of Sangamon County Department of Public Health. And the city, we used to have a public health department, but through efficiencies, it was voted to consolidate. And so they provide the healthcare access to individuals throughout the county and in Springfield. So we really appreciate her service. And one thing I can say, I'm sure she'll elaborate, is she's probably been the one thrust in the limelight during this pandemic most of all. And, nobody expected what we're up against right now, but she's done a great job trying to usher through very difficult, challenging times. And we really appreciate what she's done to this point. So, Gail, if you'd like to introduce yourself, we'd appreciate it. Oh, you're muted, sorry. If you get unmute.
Yep, so sorry about that.
Yep, good.
I'm still technologically challenged. I'm Gail O'Neill, and I'm the director of the Sangamon County Department of Public Health, and actually the Menard County Health Department too. I've been with the health department for 35 years. This is my 35th year. I too was part of the Springfield department, and been involved in the conversations and the growth of both health departments for quite some time. I started out as a health educator, assistant director, and a little bit before this started had accepted the position of director of the health department. So it's certainly been a trial by fire, but I'm fortunate to have a team of our community and our staff to plow through our challenges with COVID.
Yeah, one of the things I'd like to start out with is testing. I know with the vaccine, if you could share with us, Gail, has testing dropped off? Or I know we've opened up one, and SIU, of course, has been a great partner with a facility, I think at Abundant Faith Christian Center, but also a new one over at the former Shop and Save on Chatham Road in Wabash. So if you could enlighten us on the importance of still being tested, who should do that, and then also the best way to make those appointments.
Well, the testing is still important in our community. I think everybody's excited about vaccine, but testing will tell us what's going on in our community and actually help us control the spread even faster than the vaccine can. So we would know who is infected and who's been exposed. So there are a wide variety of places to get tested. It changes a little bit. We keep it, the information as we know it about all the testing sites up to date on our website. The site at the Abundant Faith is at no cost to anybody. There's no restrictions. Anybody can test there with the SIU program. And the Illinois Department of Public Health has put some testing sites, and it's moving this week from this side of town to over at the Shop and Save parking lot off Chatham Road and Wabash. It again runs from 8 to 4, and there's no cost and no restrictions on who can test there. The other healthcare providers have a variety of different, whether you're symptomatic, and everybody's a little bit different, but there's quite a bit of testing available in our community. So we're fortunate.
And then Walgreens, I know they have a convenient method where you go online and register and you set the schedule. Can you speak to that, Julia? I don't know if you can tell us how backed up you are, but you do get responses I think within 24 hours. But if you'd share with us your process.
Sure. We have a couple different types of sites, and we're expanding and continue to expand as testing kits become available and the Abbott machines become available. So you can make an appointment online or on our app, and we have two different types. One that is sent away to a lab, and that usually comes back within 2 days. And then we also have the point of care sites, where those sites you get your results where they're processed online right there, and you get the results same day in those sites. And we're continuing to add new sites, so we're expanding, and access is pretty good at this particular point. Appointment times are fairly available, so as we continue to expand that, that'll continue to hopefully ease up any constraints that you might see.
And then Dr. Sundareshan, how important is it to do the testing right now? And are we seeing the test being done in all our populations, or is there still a challenge with, various groups that aren't being tested that need to?
Great question. So testing is very important. Anybody that is symptomatic, still, if you look at the possibility of COVID versus any other infection, although this is the flu season, we will rate COVID the highest there in terms of possibility. So it is important to get tested if somebody has symptoms suggestive of COVID, and those are respiratory symptoms like runny nose, cough, even a loss of smell, loss of taste. Those are classic symptoms. Fever, headaches, muscle aches, any of those symptoms, one should think about testing, and especially if they have had exposure. Yeah, we have a fair amount of testing and testing sites available. SIU has a mobile unit, which they are able to take to different locations on Fridays to be able to do testing. So definitely the testing is more equitable than it used to be with this mobile unit, and also the various sites offering testing now. So I think it's definitely good the way it is right now, and the more sites we can add, it will definitely be helpful because testing is absolutely essential. Like Gail O'Neill mentioned, that in addition to vaccines, testing should also be available.
And then on the same vein of testing, Dr. Sundareshan, antibody tests, are those important, or what's your thoughts on that? The antibody testing?
Yeah, so testing, it's very important to know what kind of a test somebody is getting, even the type of machines, like Julie was mentioning. Abbott machine is something that can give us test results right away, point of care. And Abbott alone has different types of testing. The testing that is used for point of care can also be an antigen testing. And when you're using an antigen test, there is a possibility that somebody could have a false negative test or a false positive test. So we need to make sure that the type of testing that's done is also highly accurate. So interpreting them becomes easier that way. An antibody test that you were mentioning, Amir, antibody testing has very limited utility at this point. People who have been vaccinated and may have symptoms, sometimes after a first dose, you might want to see how much of immunity they've developed, if they already have immunity at that point. And also, if people get symptomatic after already having had COVID, do they still have immunity? That's where antibody tests can be useful. We don't use antibody tests as much.
Mm-hmm. Okay. And then Director O'Neill, if you could share with us, I didn't know what the recent numbers are with regards to Sangamon County, and I didn't know, I guess we're still in the phase with the regional approach as well. I didn't know if you have those numbers. If you do, if you could share those, where we stand, and have we seen a influx of the variants? I think there's the UK variant or the African variant, which is a different modification of the COVID-19, but if you could share anything on those lines. Oh, you're muted. There you go.
As far as the variant goes, we had heard that there may have been a test that was gone through in our region, in our area. They had identified someone during kind of just random testing of samples that were in that appeared to be a Sangamon County resident, but in fact was not. And it had no impact on us at this time, but it seems that it's a matter of time as people move around and that we will see some of the variants. Dr. Sundareshan has a better approach on what that means to us as a community, but we really have not seen it here. We have had 15,000 people, Sangamon County residents, that have been positive with COVID, and we've had 207 people die related to COVID as well. So those are not good numbers for us to have. Our positivity rate has gone way down, which is a really good thing. That's one of the things that helped us move out of the warning categories with the state, from being orange on the map to being back to blue, to being able to move to phase 4. And pretty much that's statewide now, which phase 4 is trying to reopen the state a little bit with our businesses and being cautiously optimistic that we can kind of go back to a little bit less restrictive life and limit the risks that we have. So these are good things, but we don't want people to forget to wear the masks and to keep the distance and the things that we should be getting used to by now. It's kind of hard to believe we're about a year into this. So it's something that we are currently battling. And the newest tool we have is the vaccine. And as you've mentioned, and as we've all heard, the vaccine is a great tool. We want to have about 70% of our population vaccinated, if at all possible. One of the good things is, for all the frustration that people have with getting appointments and getting the vaccine, is so many people want it. That's such a great message for our community. There are pockets that probably don't. We still need to deal with myths and truths about the vaccine, but a lot of people want the vaccine and are anxious to get it. And the only thing holding us down as a community from getting everybody vaccinated rather quickly is the volume and the availability of vaccine.
Yeah, we'll touch on the vaccine in a moment. Dr. Sundareshan, if you could, on the variant, have you seen anything changing here, or are we pretty much, well, I imagine the majority is COVID-19, but I didn't know if we've seen many of the variants that they've talked about.
Yeah, so, on the IDPH website, they mention 22 statewide numbers of the variants. But to explain that a little bit, we have 3 variants that we need to kind of be concerned about. And also some small differences even locally in the COVID infections that are circulating. So the 3 main ones are the British strain, B.1.1.7. There is a South African strain, B.1.35.1, and then there is a Brazilian one, P.1. So we kind of look for these. The lab at IDPH does surveillance on a regular basis. On a weekly basis, they send samples from geographically diverse areas to look for these. Weekly, they look and these samples are sent to CDC. They're sent to labs, which can do the genetic analysis to see if the strain is present and circulating in the community currently. In Springfield, we have not really identified any of those strains in the tests that have been conducted from here, but statewide, yes, it has been seen.
Okay. And then Julie, switching to the vaccines, Walgreens, how's that work, or what ones do you carry as far as vaccinations go? And then also, I think, do you get yours through the state or through the federal government? And how's that supply look? How do you determine the distribution in Central Illinois?
Okay, so yes, we have a couple different programs. So we have partnerships with the state. So we have the 1A partnership that we have going on in the long-term care facilities, where in the Central Illinois, we're about halfway done with the second clinics at the long-term care facilities. We have 1B that's supported through the state, and I think we have about 5 Springfield area locations that has the 1B in the stores, and those are both Pfizer products for those. We just have started, or you're going to see probably this weekend, we have started the federal partnership program, which gives us Moderna. That's going to be expanded through the majority of the Springfield locations. You make an appointment online or through our app, So we have pretty much almost all of the locations in Springfield covered, either with Pfizer or Moderna. I think there might be one or two locations that might not have it. The appointment scheduler sort of opens up as we get vaccine available and makes additional appointments. When you do make your appointment, it makes both the first and second dose appointment for you, so that you really only have to go in one time and make both appointments right at the beginning. So it sort of books that series, ensuring that you have a second dose available. For the Moderna, for the federal partnership, it's a little bit more as we have vaccine available. So we're going to be doing some in-store clinic type of programs where we'll make some appointments Friday, Saturday, Sunday type of thing. So we have the vaccine available. You'll be able to do those sort of as maybe like pop-up clinics as we have those available. And then the Pfizer one, we have a little bit more steady supply in locations. So as we have that, we've really worked on access and being able to expand that as supplies steady up, expanded across multiple stores.
And the website they need to go to they can sign up for vaccinations at Walgreens.com or what's
If you go to Walgreens.com and go to the Find Care options, there'll be COVID vaccines there. Or you can also do it if you have the Walgreens app on your phone. Same type of thing. You go into the app and then you go to Find Care and there'll be a Walgreens link there.
And then Gail, on public health, can you define the 1B real quick, the parameters of that, and then again, what vaccinations you're offering as well?
Sure. 1B is a large group of the population. Unless you're not in 1B, then 1C is. But 1B is basically anyone who's over 65 and people who are frontline essential workers, school teachers, school personnel, people that we need to keep our daily lives going, people who, work in the grocery stores and we need them there for that, people who, it's a wide variety of lists and it's for our daily living, schools, the groceries, the utility companies, people who help with, keeping the food supply safe, farmers from the meat and industries that keep us going. It's basically everything that keeps us, fed and clothed and housed pretty much, that those people fit in 1B. 1C will come around when it's people under 65 and more of the bigger chunk of the population as well, those people with illnesses and other problems. So basically you kind of have to look and go at the list. It does get modified from time to time. So currently 1B is set by the federal government and we try to go by that as much as we can.
And then you're offering them at the site on Ash Street, right?
Yeah, we're on South Grand Avenue.
Oh, South Grand, yep.
Yeah, between Penny's and Popeyes. We have a drive-through location. We offer vaccine Monday through Sunday, basically 7 days a week, starting at 8:30 in the morning and stopping at 3:30 in the afternoon. And so far we are just about 9,000 doses provided to the community. Some of those, not many, are second doses. We've only been using the Moderna vaccine at this point. That's all we've had shipped to us. We've heard that it's going to change at any time. One thing that we've had building in our community, and we're very fortunate, is a really great partnership, starting with testing, starting about what are we going to do about this new disease, is our partnership with SIU School of Medicine, Springfield Clinic, Memorial Health System, and HSHS St. John's. And so we've been partners, and they are all, along with us, ready to provide as much vaccine as we can physically in our community so that this doesn't have to drag on and on trying to vaccinate everyone. The only thing that's holding us up is the supply of vaccine, and we're hoping that changes, but everybody's geared up with a commitment about at least doing 500 a day so we could get the community, along with the other partners in the community, the Walgreens and other providers. But it's like everybody, it's having the product is what we need at this point.
And how many vaccinations are you currently giving on each day on average, would you say?
Well, we've been, I think because it's cold, we're moving faster because we started with a goal of about 300. It's been real close to 400. It was 405 yesterday. So 375 is a good average now. We're doing quite well with vaccinating people. And, once they get their appointments, they're happy when they come through.
Great. And then Dr. Sundareshan, can you explain the difference, or should people want to have one over the other, or does it matter with regards to Moderna or Pfizer? And I think Johnson & Johnson's coming out with one right now. If you could explain the difference. And then also, I guess you have to have the same shot both times.
Correct. Great question again. Between Moderna and Pfizer, these are the two vaccines that have currently been approved in the United States. We're also looking forward to getting AstraZeneca as well as Johnson & Johnson vaccines. Johnson & Johnson, hopefully we'll have an emergency use authorization hearing pretty soon. And then if that comes through, that should be available. Between Moderna and Pfizer, there's both of them are about 95% efficacious, which is great. And even with the side effects, the reported side effects, which you can track on an app, and then CDC reports them. It's a app called vSafe, which helps track these side effects. About 2 million people have reported their side effects on that. And between the two vaccines, they're comparable. Arm pain, arm swelling, fever, chills, just tiredness, general fatigue, they're pretty much the same, comparable between the two vaccines. With Johnson & Johnson, the only advantage is that you don't need two shots, it's just one shot. It's a little less efficacious as compared to the others, but we're waiting for more information as the emergency use authorization comes along for that.
So I guess the rule of thumb would be people should just get the vaccine as soon as possible. Don't wait, because I think all three of you probably would agree that the demand is a lot higher. So you don't want to take your chances not being put in the queue, so to speak. Can you answer this, Dr. Sundareshan? Is the vaccine, does it contain COVID-19, or how's that work?
So there are different types of vaccines. What we are currently using is an mRNA vaccine. It does not have any live vaccine. It does not have an inactivated vaccine. It is part of a protein genetic material, which very, very small part that codes for the spike protein, which is part of the COVID or SARS-CoV-2 structure. So it does not have any live virus or even an attenuated virus as part of the vaccine. There are other types of vaccines. There are inactivated vaccines. And there are also vaccines which have a coat of an adenovirus, which helps keep the vaccine component more stable. But as of now, what we have is the mRNA vaccine. Pfizer and Moderna are both mRNA vaccines.
And then on this, I'm going to dive into the questions real quick. This one, whoever would like to answer this, this is probably a concern a lot of people have. This one actually has a compromised immune system being compromised, and they said by Evans syndrome and sister diseases. And what precautionary measures should they take, or what's the best way to approach getting a vaccine? Because they were told to quarantine as much as possible, stay away, so they don't want to expose themselves. Any advice you can give them if they have a compromised immune system like that? Oh, Gail, you're muted. Okay, go ahead.
Go ahead, Gail.
I was going to have you do the medical part of that. We know that it's frustrating for people that might not be in the right category at the right time for vaccination, and that's why the advice is to keep yourself as safe as possible. Depending on this person's age, they may be eligible. We know that the appointmenting part of it has been a challenge, and we've worked to fix that a little bit where we had a lot of it available online. So you could go to the website, and people that were very good at using computers could take up a lot of the appointments very quickly. So we've worked to make sure that there's a certain number of appointments that are available for people that just call in on the phone. So we're trying to improve that situation. And as we open up new appointments, we have new avenues to try to do that. So that's one of the ways that people, especially those that are compromised, may want to wait. By going through a drive-through situation, you may not have to get out of your car and might limit what you your exposure to other people. That's one of the challenges of doing these big clinics is even if you're inside a building, you need to separate everybody, still have a 6-foot distancing, still while you're vaccinating and while you're waiting. Part of the process is waiting for at least 15 minutes after your vaccine. Some people with sensitivity need to wait a half hour. So all the while with the spacing needs, that presents a challenge that you really don't have in a car. Dr. Sundareshan, did you want to talk about the illness?
Yeah, thanks, Gail.
Thank you.
So I think the question was specific to Evans syndrome, and that is and again, people do need immunocompromising conditions. It is a disorder with the blood and platelets particularly. So any type of immunocompromising conditions, if somebody is taking medications, there are 3 things that CDC tells us. That you need to continue to do what you do in terms of the 3 W's: wash your hands, watch your distance, wear your mask. So make sure you're minimizing your risks even after vaccination. The other thing CDC tells us is that the immune response that somebody may get after vaccination may not be as much as somebody without an immunocompromising condition. And the third thing they tell you is that when the vaccine trials were going on, they did not include that many people with immunocompromising conditions as they did of the other groups. So the data that we have so far on immunocompromising conditions are less as compared to the other groups, but it is still very safe. It's still better to get the vaccine than get COVID. So talk to your doctors and make sure that it's okay for you to take the vaccine. It doesn't matter which group of immunocompromising condition you fall into. For now, for most part, it is very safe to take the vaccine than get COVID.
And then at Walgreens, Julie, do you have it in car? Is that how you deliver the vaccines? You just stay in your car and you deliver it that way?
No, currently they're done in the store, just like our flu shots are done in the private health rooms there. Yes, we don't have a drive-through option yet.
Okay. Yeah, actually, this is the first year I got my flu shot, and it was at Walgreens. They did a great job. So we appreciate that. The other thing with regard to that, if you both have the county public health and Walgreens both have the same vaccination, say it's Moderna, I think you both mentioned you use Moderna. If I got my first shot of Moderna at Walgreens, could I go to the Sangamon County Public Health and get my second shot, or how's that? Or do you have to go back to the same place that you got your first shot?
Well, that's a question that people have been asking, and it's a little fuzzy from time to time for us to know. And I think we've heard from some of the more elderly people, I think that may be confused that they got their first dose at Walgreens and then they were told they needed to call us to get the second, which isn't really too big of a problem unless we don't have the same vaccine. That does present a problem. And I heard Julie say they're making second appointments, so that may not be a reality. But basically, the biggest thing is to have the same brand of the vaccine. When we make our requests for vaccine, the state doesn't want us hanging on to the vaccine for second doses. So basically, our shipments for second doses are supposed to come based on the number of first doses we did. So it could be a challenge if everybody was trying to get second doses at different places. It's generally believed to be better to go to the first place, but the brand is the most important part.
Julie, anything to add to that, or?
No, I think she's absolutely right. I think we're doing a lot of enhancements to the scheduling, our scheduling system. We're recognizing that because of the supply issues, we probably want to go ahead and schedule both appointments just to ensure people have that second dose or the completion of the series. So we're doing a lot of enhancements and learning as we go with those enhancements. it is most important that they get the same product. And I do think that as we go forward, there'll be a lot more less supply issues and a little bit easier scheduling as we start to finesse a few of the technology issues that you sometimes see with these as you go fast to get these things up and running and whatnot. So.
Yeah, and then I think this next question is probably for Gail or Dr. Sundareshan. With regards to consideration to essential workers or frontline workers, I know some people made the comment, said, well, I'm more essential than that group. But I didn't know if, do you reassess who would be considered in that group, or once it's set, it's set? What's your thoughts on that? And what particularly comes into mind are individuals maybe taking care of the elderly, or, maybe people that are, beauticians, or, someone coming in regular contact with a lot of individuals.
Yeah, that's really a challenge. And every once in a while, I would make the wrong decision about expanding the group and find out that I had made a choice. If Dr. Ezike calls and says, you decided this person needed a vaccine, I'm like, oh, well, I guess that was the wrong choice. But it really, going by the list is probably the best way to do this, so that, everybody has a story, and your heart breaks for so many of them that you want to help them get vaccinated. But based on the allotments and vaccine, it does make a lot of sense to use the guidance of that the CDC provides for the group B. It's exciting if so many people want it. It's just hard for them to be patient. And, look how far we've come in this short period of time with vaccines. So within the next month or two, I imagine almost everybody who wants vaccine should be able to get it. So I think staying in the 1B is the lane we need to try to stay in, is to be as fair as possible. 1A was our first big focus because it was the healthcare workers, and our first two allocations that came, we sent directly to the hospitals because they were full. They had a lot of people working with COVID positive patients, and we needed to help them. So the healthcare workers were the big focus at first, then the other caregivers, as you say, and then moving into 1B. So it's a staged situation based on the availability of vaccine.
Now, on the medical, like the hospitals, especially SIU, and you have Memorial and HSHS, when they start giving vaccinations, do they receive those directly, or is that just distributed through the county or the state, or how's that distribution system work? And then is there, what's the reporting aspect? Do you have to keep track of how many you're giving out? And is there, as far as the accountability of that, how's that whole process work?
Well, every person that gets a vaccine has to have their information about them into a vaccine reporting system, which is called iCare in Illinois. And it puts, everybody's vaccines. It's been around for a while, but it's used for children, it's used for everyone. But the importance with COVID is that we make an agreement, if we take the vaccine, that within 24 hours, we'll have that information about that, who was vaccinated, within 24 hours into the iCare system. So we currently operate that the last person doesn't go home till all the iCare entries are in. That's how they know how much of the vaccine supply has been used and how much might be sitting. Early on, we had a little more sitting on the shelves than the state was happy about. We were still not sure about getting the second doses and things. So we've been getting vaccine for a few weeks on a regular basis. So we're more trusting, and we have been able to share vaccine with the healthcare providers in the community. At some point, they'll be able to order their own for their supplies, but right now we try to share what we have as a community.
And then I'll just go through these questions, and whoever would like to answer them. One is any predictions or when the time frame would be to go to phase 2 vaccinations for people under 65 with no serious health risk. Any projections there? And no, there's no right or wrong answer. It's just we won't hold you to it. But I've heard like spring, maybe summer, or maybe it's later. Maybe it's in the fall. Any idea on that?
I don't have.
Or nobody wants to take the risk.
Dr. Sundareshan, do you want to weigh in?
Well, there are many trackers, vaccine trackers, and we're doing really well. I was just reading this morning that I think the vaccines that are being provided now are at a 54.44 vaccines per second globally. So, we're doing pretty well. I think the real issue is how much of supply we have, and that tends to change. So supply is the biggest issue, and hopefully we will have enough. And also with multiple other vaccines which are in phase 3 and more of them being approved, I think that will definitely make a difference too, with the speed at which we're vaccinating and getting more people vaccinated.
And then here's another one. They want us to get out our crystal ball. With what percentage of our community do you think will be vaccinated by May, July, and October? So in the spring, I'd imagine it's probably going to be 10%, do you think, or any idea on that? And then July, and then October. Any thoughts there? Oh, Gail, you're muted. Oh, go ahead. Whoever would like to weigh in.
Actually, we are at 22% in Sangamon County already. So we're kind of happy about that that's going so well. We'll see that continue. I hope but that's people for their first vaccination. There's 4.7% of the population is fully vaccinated. So of those, 9,000 we've done, we're coming around on over half of them being on their second dose. So fairly quickly, we will at least have close to 20%.
That's great.
I just want to add, our goal should be 80% and over. That should be our goal. The more people we get vaccinated, the better herd immunity we'll have. And, we will be able to tackle all these issues with small strains and variants much better if we have good herd immunity. So our goal should be at least 80% and higher.
And then someone did ask, they have their first dose of Pfizer, but they're having a difficult time getting in to get their second dose. Any suggestions on the best way? Can they, one, I guess, would they be able to, I couldn't remember if public health offers Pfizer or not. And if not, then Walgreens would be the option, I think, or unless somebody else provides it.
Well, currently we haven't used Pfizer. Springfield Clinic has Pfizer. And both hospitals have some Pfizer. They use that initially. But I know Springfield Clinic has been routinely getting Pfizer. I assume Walgreens may have it as well.
Yeah, we have it at a couple of the locations. Yeah, a couple of the locations. So the state-supported locations in Springfield have Pfizer, and those are the ones that have been open already. Again, the federal ones that we're going to be sort of doing as we get supply, those are Moderna. So the best chance is probably through us, through the sites that have already been doing Pfizer in Springfield.
Yeah, I guess the advice would be check with your primary care physician, or if you have, God forbid you have a heart condition or something, or multiple doctors, try to use all those avenues. And then, but again, use Walgreens whenever you can, and hopefully you'll be successful in getting in. The other thing is, should people get concerned if they've gone past the 3 weeks or what have you, or is there a certain time frame where if you did not get your second vaccination by, that you have to start over?
So there is a grace period for up to 45 days that you could delay the vaccine. Pfizer, more data as compared to Moderna, you want to still stick to around those 28 days. Typically for Pfizer, the second dose is given at 3 weeks, but you can stretch that out much more if you're not able to. And then with Moderna, the second dose is recommended at 4 weeks, not 3 weeks, but you want to stay as close as possible to that. But if you're not able to, it's a little delayed, you still have antibody response. And there's no need at this point for a third dose. We're still sticking to those 2 doses.
Okay. Anybody else want to add anything to that?
I think that's a really good point. Sure. Yeah, sorry, I think I have internet issues here, but I think that's a really good point, because sometimes patients get very nervous if they are going on to try and book a second appointment. For those that had 1st. The system is just now being updated to schedule both at the same time. But if you were in one of those earlier versions and you had a first appointment, now you're trying to book a second appointment, and you see that there's not an appointment available until day 24 or 25, and you received Pfizer, that there is a grace period. And so not to be too concerned if you're more towards that 28 day, go ahead and still book that appointment because that's still within the CDC guidance, and you'll then complete that series and have that immunity.
Yeah, someone questioned, they said it seems like it's getting harder to get appointments. If they've already had their first vaccination, is there a way to meet that window of opportunity? Will that be taken into consideration to kind of move them up on the list, or how's that work? Or it's just whenever you get in the queue and that's how it is?
We realized that there's a need for second doses, and trying to balance first and second doses in our scheduling has been a challenge, and we're getting better at that as we go along. The appointments, we found with our system that, people were having to make appointments farther out than they wanted to, and farther out than we'd wanted them to. So we had gone back and found that in our system, a lot of people had booked 2 appointments instead of 1. So we've been going back and getting rid of all those. So there are openings for second appointments, a lot more than there were. So we encourage people to check back. And if they have a late one, to check back, cancel that one and get another one, because we are increasing the number of second doses appointments available.
And then a couple other questions along that line, and they'll probably be mixed in, but one is, if someone's tested positive for COVID, or if they've already had COVID, I think they still should get the shot, is my understanding. But if they tested positive, how long, or if they had COVID, how long should they wait before they get the vaccination?
That's you, Vidya.
So if someone's had COVID, CDC says that as soon as they stop being symptomatic, they are eligible to get their COVID vaccine. Earlier, we would say wait for 90 days till your natural immunity kind of still protects you, and you can go lower down on the list. But now CDC says it's okay. As soon as they stop being symptomatic with the COVID episode, they're eligible. However, what we have seen is somebody that's just had COVID and gets a vaccine close to the time that they have just recovered, their symptoms or their vaccine reactogenicity, or the side effects that we say with vaccines, can kind of be a little more than less. So it's okay to wait. Definitely discuss this with your physicians to see how long you can wait. But it's okay to wait for people who have had COVID for up to 90 days, because they do have antibody protection from the natural infection.
And then we'll stay with you, Dr. Sundareshan. Two questions in this one. It says, can you define pulmonary disease for high risk, and does that include asthma?
Yes. So asthma is definitely high risk for getting COVID. So they have not, for 1C, it's anything that kind of increases your risk, high risk conditions, you should still qualify with 1C. As long as they're less than 65 years of age. If they're over 65 years of age, then they immediately get into 1B category.
Okay. So if they have asthma, it's really driven by the age of the individual, what class they'd go into.
Right.
Okay. And then for those who have mobility issues, who are elderly, they'll get their shot, but sometimes they'll have a tough time coming in for their second one. What advice would you give them? Any ideas on, is there assistance with mobility, or I know Walgreens, I think they were going into group settings. You can correct me if I'm wrong, Julie. I thought you would go in when this first started, going into senior centers, things of that nature, and applying the vaccine there. But I wasn't sure if if it's an individual maybe living at home, has mobility issues, is there any assistance with regards to getting them to the place or the location where they need to go?
I can talk about, so we did, yes, our first initial was assisted living, skilled nursing facilities, Those facilities were sort of approved by the CDC, and not all long-term care facilities qualified for that. That's what our initial batch of vaccine and our contract was, to immunize. And now that we're getting, sort of, we're at the halfway point for the second doses, we're getting towards the end of that. We started the in-store. I don't know that I have a great answer for mobility issues or people that are homebound at this point. So I don't know if anybody has any other solutions that you guys may have at this time for those folks.
We have talked about, because there's a certain percentage even with flu shots of people that just cannot get out. And we, in the past, have made sure that we find a way to get them vaccinated at home. We look down the road, basically at providing that service, especially those that are homebound, and generally they have caregivers that may have already gotten vaccinated. On one hand, as long as their caregivers are vaccinated, they're pretty safe if they can't, if nobody's going to bring it to them, which we'd hoped. But we realize there's a percentage of the population that may need help, and we will try to address that as we move through this.
And then I know SMTD, they have a smart system. I think they do provide some rides, but we'll check into that and post it online if we can find some definitive answers with regards to that. Two other questions. One is, where do restaurant workers fall into a category? Aren't they in 1B or no? Are they in 1C?
That's a good question. I think Vidya's looking it up. I was just thinking it might be 1C, and partially that's due to age. I'm not sure at this point. I would say 1C.
Yes, so all they have with food and agriculture workers are processing plants, veterinary health, livestock services, animal care, postal services, but yeah, we do not have restaurants listed as part of 1B.
And these parameters are set by CDC, aren't they, on the federal side of things, since that's where the distribution system's coming from? So there's probably not a lot of flexibility with regards to the parameters. Is that correct?
IDPH has that too. IDPH actually made a few changes with the age. CDC said 75 for 1B. IDPH actually went with 65. So yeah, there are subtle changes there, but for most part, they're similar.
I must have I don't think I covered that previous question correctly. It says advice you can give those taking care of those who have mobility issues. They went for their first shot, but they're reluctant to go for their second one because of mobility. Any advice you can give them to encourage the individuals once they got their first one? It's important to finish. Any thoughts there?
Absolutely. So if somebody's gotten their first shot, you're about 50%, 50 to 55% immunized. With the second shot, that goes up to 95%. So definitely 2 shots are better than just getting 1 shot. And you have that grace period. So, if you cannot make it right at that 3-week or 4-week mark, you still have that grace period. So I'm highly encouraged to complete the series and get the second shot.
Right. And Mayor, you mentioned the smart vehicle system, and that will bring people to us or to the healthcare providers. We do, and I'm sure all the places do as well. We would, because they wouldn't have a car, we wouldn't put them through a drive-through. They could come and request a service inside our clinic if that were the case, if they were able to get by cab or by bus or some way to do that. So if that, when you first started talking about mobility, I was thinking totally immobile, but those that may have some challenges and could use a bus system, yeah, we could take care of them.
Great. And then this last question, they're asking, when do you think Sangamon County will go to phase 5? I believe that's when we've reached herd immunity, I believe. Or do you know when that would be, Director O'Neill? Or
we have to have, I think, like Vidya was saying, our goal of about 80% vaccinated. Okay. pretty much going to phase 5 means we're almost back to normal. And I think it's going to be a little while before everybody is totally convinced. I mean, kids could go to school safely and we can go out, you know, and be unmasked. I don't know if that's even in phase 5, but it seems like it's a little ways away. Phase 4 is a good step for us. I don't have an idea for sure. It's in sight, and that's something that we need to have a goal. I think we're a few months away from that for sure.
Yeah, I think it'd probably be more towards the fall, be my guess. But the more we get vaccinated, of course, it improves our chances of keeping businesses open and to full capacity. So we really appreciate everybody doing that. One last thing, and this is my own opinion. I always thought that, you know, I'm not saying it's like the flu, but to me, it seems like as we're expected to get the flu shot every year, don't you think we'll have that with the COVID shot as well? Don't you think do you think it will be an ongoing annual basis?
We don't know. It may be so. It may be so because, you know, with the new strains that are coming, viruses do have a tendency to shift and drift their genetic material. So, you know, their response definitely changes with the change in the genetic material. So the vaccines are a good way to kind of make up for that. It depends on how much. We don't know that yet about COVID, but I was reading that some of the scientists from J&J predict that this may be an annual vaccination, just like the flu, and it very well may be so.
Mm-hmm. So we're already upon the hour, so I appreciate everybody's assistance on this important panel. This is probably the most questions we received from the public, so it tells you how important and how tuned in people are. But if you'd like to make a brief closing comments, and we'll start with Julie Bickers. Thank you for being here.
Well, thank you very much for having me. I'm really glad that we are able to work as a community to combat this and to really raise the health of our community. So thank you for having me today.
Well, thank you, and we really appreciate Walgreens' partnership in this to help get the vaccinations out and as well as the testing. Gail, thanks for being here. We really appreciate your participation.
Well, thank you. I appreciate the opportunity and encourage everyone to be aware, watch the media, check our websites of any of your providers. And as soon as vaccine comes in, we'll get appointments out there. And that's the best way to know, because this changes on a daily basis.
And should they go through the county website, and what is that? Or would it be the Illinois Department of Public Health?
No, the county website's a good start. It's www.scdph.org, Sangamon County Department of Public Health.org. We also have the hotline, which is 217-321-2606. Thank you.
Thank you. 321-6206.
Correct.
Great. Dr. Sundareshan, thanks for all you do. We really appreciate it. Thanks for participating.
Thank you, Mayor. I really appreciate the opportunity to be part of this conversation. I would just like to say that, you know, continue the 3 W's. They're very, very important despite vaccination. Till we get a good number of people in the community vaccinated, I think it's very important for us to continue doing what we are doing. There has also been talks about double masking. So the mask fits really well, mask fitters. So definitely look into those. That protects a lot. And then, you know, for a lot of us who are scientists, the whole process of, you know, vaccination and how we control an epidemic or pandemic, we read about in books. This is something that's happening in front of all of us. We've seen these discussions happen in a scientific fora, but for the first time, how it happens is unfolding on a global platform. We're seeing that happen. So, you know, there are a lot of things that we don't know, which we learn about and which we relearn. And we just have to be in it together and learn as we go.
And real quick, I'll throw one last question. It came in at the end. Side effects of the shot. When should someone, I imagine it impacts people differently, and when should someone be concerned where they would have to call their physician back up?
Up to 48 hours is a good time. Some generalized fatigue, headaches, fevers. They can take Tylenol if it really becomes bad, even after the shot. Try to avoid taking Tylenol or ibuprofen before going in for a shot. That can decrease the immune response. But after the shot, if you need it, you take it. And after 48 hours, if your symptoms persist, definitely reach out to your provider.
Great advice. We really appreciate it. And again, thank each and every one of you for participating, and we really appreciate our Facebook viewers. If you still want to send in a comment, you can at feedback@springfield.il.us. And you can go to our website. We do have a COVID page at springfield.il.us. And we do have the links to Sangamon County Department of Public Health, as well as the Illinois Department of Public Health, and a lot of great information there. But one thing as we move forward, we are partnering with St. John's School of Nursing and College of Nursing on a mental health. It's taking care of your mind. And so each week we're going to have a kind of a wellness fact or information that we'll distribute through our neighborhood news. So you can sign up through our website or look at our website, and we'll post that, because that is becoming to the forefront. It's not only the virus in itself. If you get it directly, it impacts you, but it has an impact on all of us with regards to our day-to-day living. And we may not even realize how it's in fact impacting our mental health as we move along. But we really appreciate everybody staying strong, working together, respecting one another, and doing all you can, as Dr. Sundareshan said, is the 3 W's. Watch your distance, wash your hands, and of course, my favorite is wearing your mask and moving in that direction. And we'll get through it. I think we're on the downhill slide of this, but we do have to stay vigilant. One thing we should remember too is Friday, the city will be closed. It's Abraham Lincoln's birthday. So we hope everybody enjoys it. And, you know, his words live on today as they did back when he walked the earth. And my personal favorite, I've said it time and time again, it doesn't matter what level of government you're in. It's all about government of the people, by the people, for the people. And if we'd all remember that and live how he did, we'd have a lot different country than what we do today. So we'll continue to strive that. And as always, hopefully we'll see you next week at noon for Facebook Live. Until then, let's make today better than yesterday and tomorrow better than today. Thank you very much. Have a great day.